that I think are important because I want to be part of the solution. The first one is that the family issue that was raised is very important. Advertising is on family time. Parents have purchasing power. Children have nag factor power. And that is when there's an opportunity for the two to be together and for dialogues to be had. So some of that time could be well spent at creating dialogues by the industry. The second point is that coordinated efforts by food industry, retailers, and local government programs are needed. Essentially, programs that work for both from the economic perspective will be successful for all. And third, taste preferences, especially among young children under 8, are formed early. And we need to pay special attention to this because that is how we get change over the long term, by creating taste preferences for healthy eating. Thank you.
Great, thank you.
Good afternoon. My name is Cristal Morales, and I'm with the Ultimate Health Services Corporation. We provide services to over 127,000 patients in Los Angeles and Orange counties. And our patients have multiple health conditions, including obesity, diabetes, and as well as heart problems. But we need, and I'm asking this sincerely, we need a legislation that addresses the issues that have been discussed earlier. Something similar to SB 19 that was introduced by Senator Escutia in 2001, which was passed but never implemented. Of course, the American Beverage Association and the National Soft Drink Association that represents Pepsi and Coke, amongst others, filed legislation in California as well as Washington, D.C. that will regulate the marketing and sales at public schools. And also SB 1520, which was the tax soda, introduced in 2002, which died in the committee, of course. But what we need is something that addresses the issues, but also we need to work together, as it resonates with some of our colleagues. We need to work together, government, schools, health services organizations, as well as businesses, and also invite an opportunity for the state senate and the assembly, as well as the national level, to ensure that we secure funding for health services, preventive as well as the treatment, for the same reason, because of diabetes, obesity, and other health problems. And of course, last but not least, to reinstate health programs and services that have been cut because of the budget cuts, such as the optional benefits that would give an opportunity for people, low-income people, to obtain, adults to obtain dental and podiatry services that are well needed. So with that in mind, I would like also to thank you on behalf of Ultimate Health Services for hosting this hearing. Thank you.
Thank you.
Senator Flores, Reverend Sal Alvarez, representing the Dolores Huerta Foundation. I'm the Vice President of the Foundation, and then also representing the National Health Commission of LULAC out of Washington, D.C. It's the oldest Latino civil rights organization. We want to applaud Senator Padilla and Senator Alvarez and yourself and Senator Price for holding this hearing. We are very concerned about the chronic diseases of obesity and diabetes, and like yourself, looking seriously at the sugar content issue that's been raised here. And lastly, let me again thank you for the leadership that you've taken in supporting the public option of the health reform bill that's being heard by Congress, and for joining Dolores Huerta in a 48-hour fast that I understand that you'll be embarking upon tomorrow at noon. I myself am fasting, and we're asking people around the country to fast with you. Thank you.
Thank you. Okay, any other comments? Okay, seeing and hearing none, Senator Padilla and Senator Alquist obviously are not here at this point. I want to thank them both for running a very, as I said at the beginning of this, long overdue hearing on this issue. I am going to speak with a little liberty for Senator Padilla and Senator Alquist and let you know that we will carry this hearing over to Sacramento. I am not, if you will, the chairs of either committee, but I still am the Senate Majority Leader, so I want to make sure you know that the Senate caucus will hopefully get the transcript from Ms. Moret, and we will have an opportunity to peruse that transcript, and I guarantee you that we will have another hearing in Sacramento, including the Food and Ag Committee, which I do chair. And so we want to make sure that we will then look at the transcript, follow up on comments, and get even more precise on this particular issue. These types of hearings are only important until we kind of figure out what, in essence, were the important things from this hearing that we can take and present to other members of the legislature. So I do want to thank everyone for coming today. This is not going to be the last time you hear from us, and it won't be the last time you see us on this issue. We will ask you to do a little traveling, if you will, to Sacramento and provide additional testimony. So with that, we will adjourn the hearing. I assume that the transcript for this particular hearing will be available within the next couple of weeks, and we look forward to seeing you in Sacramento on part 2 of this particular hearing. And I will now close the Senate Health and the Select Committee's hearing. And again, thanks everyone for joining us.